Okay.
Yeah. Okay. So- Got it. Very good. Very good. All right. Give these folks a chance to sit down. Oh, just go? Oh, okay. I've been instructed to get us underway. Oh, that's probably me.
That's all right.
Yeah, be careful of the touch screen, right? Okay, good morning. We'll try that again. So, I'm George Deely. I'm the Vice President of Healthcare Solutions at Himss' premier sponsor, Dimensional Insight. Uh, we provide analytics, technology, solutions, and services specifically to the healthcare industry. We're the perennial winner of the Best in Class Award for Analytics and Business Intelligence in Healthcare. And I am here to introduce our next speaker for the session titled The Importance of the CIO Scorecard, presented by Susan Carman, who's the Vice President and Chief Information Officer of the Mohawk Valley Health System. Susan's been in the healthcare IT industry for more than 28 years, serving in a wide variety of roles throughout the northeastern U.S. So please join me in welcoming Susan.
Is that better? Now you can hear me, can't you? Okay, so why are metrics important to us? We certainly have a lot of them in healthcare, and we'll talk about that in a minute. How do you motivate your team to meet these goals? So metrics basically are just goals that you've pulled together that add some value to your organization as a whole. So you've got to get your whole team involved in that. And when it comes to success in IT, the goals are very different than they would be in healthcare overall. There are certain things that we need to look at very specifically that other places may not need to do. And you want to make sure that whatever you're choosing are value driven. So it shouldn't be something that you decide, the day before they're due and you bring them into your boss. You want to make sure you've sat down with several people in the IT organization, with the COOs, with the department heads, and said, how do you all think that IT next year can add value? And we want to make sure those values, those are cascading down from the overall corporate scorecard. Okay. We're going to talk a little bit about what types of metrics might be important in healthcare. And the ones that I'll show you are a teeny tiny subset of what you could do. So I'm just giving some ideas here. There are a million different things you can do. A lot of what we're doing right now is a little bit more manual as well. You could completely automate this whole process and not ever have to look at it again. I'm going to show you an example of one that we've used. I've tweaked it a little bit, taken out some information, but just a quick scorecard that literally you could have it up and running in a day. It's that simple. We're going to talk about how it takes a village. So if you think you're going to be the CIO or the director of your department or a manager and you're going to do this all on your own, that's not going to work. You're going to have to get a lot of people involved, and that's not just your team, it's also outside of your team. So you will experience both wins and losses when it comes to having a scorecard and creating goals. And what we all need to make sure we understand is as long as you're improving and you're moving forward, even if you didn't make that mark that you wanted to, it doesn't matter as long as you're in a state of continuous improvement. Monitoring your metrics. If you happen to hit a metric one year and then you take your focus off it, what happens? It starts to go back down again. So this is kind of an ongoing process where you really have to continually keep your eyes on those goals and metrics. And then moving on to next year. So say you have a great successful year, maybe you've made most of your metrics, maybe you've at least improved on some of them. What are you going to do next year to build on the ones from the year before? So that's really important too. And then I'll give you a little summary of everything we talked about today and a Q&A, and hopefully people will have questions. I'm going to have to drink water throughout this because I'm losing my voice. So, disclaimer from the very beginning. Okay, what's a metric? So in healthcare, we have more metrics than we know what to do with. We've got HCAHPS that talk about patient experience. And we've got Leapfrog, which is A, B, C, D, and God forbid F. Some people get an F too on that. Those are all about quality. We have CMS star ratings for hospitals. So all of these metrics, we have to keep track of all of them, and hopefully you have a fantastic analytics group, or you're doing this manually. Hopefully you don't have to do that. But what about within the IT department itself? IT is a support service. So we don't exist on our own. We're not a boat kind of floating around in the ocean all by ourselves. We are here to support the goals of the organization as a whole. So everything we do has to be reflective of those corporate goals. So they might look a little bit different. So why are we bothering with these? Why does it even make any sense? Why are you taking an hour out of your day to even learn about this? Because if you don't measure it, you can't improve it. And how many times as leaders do we have a couple of different things in our groups and we know we're just not doing very well with them? Maybe the help desk is too slow to answer the phone. Maybe we haven't built the Epic system or whatever system, Cerner system, exactly the way we should. And we kind of say, well, we've got so many fires to put out today, we really can't get to those things that really add value. we often get into a reactive state. Has anybody felt this way, where all you do is break fix, put out fires, and you say, oh, here's all these great things that could really, really help the organization, but I don't have time to do any of them because I'm too busy dealing with COVID and staff shortages and everything else. Well, this is a way to make you more proactive and put that focus on the things that really matter. And this you can do in your own life, too. It doesn't have to be just about work. So I did like that quote, because I agree with it. So, motivation by measurement. By a raise of hands, I need to know how many people are wearing Fitbits. Got a few? Okay, not as many as I thought. I've got mine on right here. Okay, would everybody say that this Fitbit company has been unbelievably successful? Correct? I mean, most people, believe it or not, a lot of type A personalities, like probably everyone in this room, love a Fitbit. Why do we love the Fitbit so much? Why is it so unbelievably popular that people even pay like $30, $40 a month to have increased functionality on it? Because it allows us to improve. Things that we never paid any attention to before suddenly are in the forefront of our minds every day. I can tell you that if my resting heart rate is 2 beats higher this week than it was last week, I am going through my head thinking, oh my gosh, was I stressed out this week? Did I have an argument with one of my kids? Or did I not exercise quite as well? I see people shaking their heads that are as crazy as I am with this. Or my favorite, and my husband's favorite, is I'm a runner, so I usually have no trouble getting 10,000 steps in, but every now and then, have you ever looked at your watch? It's 10 o'clock at night, and you're at 9,950 steps. Does this happen to anybody? You're doing this in front of the TV before you go to bed, right? That's what I'm doing. I'm not going into bed until I see the fireworks on my watch going off, telling me, okay, it's been a good, right, oh, you're jumping jacks. I'm doing it because I'm not going to bed if I don't have that done. That's why Fitbit is so unbelievably successful. By the way, I've heard there's absolutely no scientific basis stating that 10,000 steps makes you healthier. It's actually a lot less than that, but I've decided to go with that. So it's just a way to let us know that metrics do motivate us, especially people like everyone in this room who are leaders. We want metrics. We want to know how well we're doing or how well we're not doing. Okay. So how is success measured in IT? Well, it's a little bit different than it is for the rest of the healthcare system. One of the first things that we're measured on is user experience. So if you have a system that is going down, once a day for 15 minutes, or your Wi-Fi goes out and every time they push one of the wows around, they're losing Wi-Fi and they can't use their barcode scanners, or you've got patients complaining because the patient Wi-Fi is out. These are all things that are going to reflect on IT. Or the help desk, they call, someone's rude, it takes too long to answer. We are absolutely evaluated on the user experience, good or bad. Customer service, the help desk, or any of your analysts, if they can call and get their problem resolved on the first call, and it takes them 10 minutes, you look really good. If you call and you're on hold for 30 minutes, you leave a message, in an hour and a half somebody calls you back and the crisis is averted, what good is that? That's not going to reflect very well on your service delivery. So that's something you want to take a look at. Adoption of software functionality. Many of you have some of the best DMRs in the country. There's a top 3. I won't go into them because you know which ones I'm talking about. They're all great systems, every single one of them, and I've worked with every one of them, and I can tell you they're all good. But if you don't optimize that system and you don't produce the functionality that's inherent in those EMRs that you paid millions and millions and millions of dollars for, then your end users are not going to see the value in that. So you have to make sure that that functionality is there and that they know about it. Completing projects on time and on budget. We're lucky enough to have a PMO. If you don't have a PMO, you should have one. They're going to help you in IT or any part of the organization to keep all of your projects on time and on budget. Data security, big one. If you're having a breach every other day, that's reflective on you. We have to make sure that we have metrics centered around data and cybersecurity and training for such things and privacy breaches and all of that. We've got to make sure we're monitoring those areas. Network availability in the old days, and some of you can probably attest to this, when we had servers that weren't very good and network equipment that wasn't very good, networks went down a lot. It was pretty common back in the day, and I've been doing this a long time, to have a system crash maybe every other day. That doesn't happen much anymore, thank God. And some of you younger people probably don't know what I'm talking about. But these days, having a 99.9% uptime in a network is basically what's expected. If you don't have that, you probably have some issues. And then turnaround time for business goal delivery. So if the C-suite comes at you and says, this is the number one thing you need to do, you need to be able to produce that. Another one that's not on here that's very important and becoming more and more important is staff turnover in IT. I've been really lucky and not had a lot until very recently. And one of the things we're all up against right now, everybody in this room, is it has become a global talent pool. No longer, if you work in Boston, are you looking for people from Boston. Now, my organization is in central New York. And that was something that was difficult because we couldn't get a lot of people with EPIC certified background in that area of New York. Well, now we're all hiring remote people. So it's good and bad. It's easier for me to get somebody now, for sure, but all my employees are being poached left and right. So what are you doing to have differentiators so your people aren't leaving? You've got to be proactive with that or you'll have a lot of turnover. So defining the goals, this is probably the most important part of this presentation, is making sure the goals that you choose are the right goals. If they're not, you're kind of wasting your time. Now, if your organization has a strategic plan, and I really hope they do, they should if they don't, your goals are based off that strategic plan. Okay? You're not going to come up with your own and then show them to your boss, and they're going to say, hey, well, I don't know, but you got to base these off of our plan. So in an ideal world, the IT strategic plan is a piece of the overall corporate plan. That doesn't always happen. I worked in an organization called UHS where they did it perfectly. They really had it down pat. But the metrics you choose must support the organizational goals. And I will give you an example of what that might look like. So if my CEO says we need better patient experience and engagement, really need that, it's one of the main goals for 2023, better patient engagement. Well, she's going to look at me and she's going to say, you need to get that patient portal adoption numbers up. How are you going to do that? Or we're still not fully utilizing online scheduling on that portal. Why not? What are you doing to make that happen? So those are some of the things that I can help with to move that forward. And I didn't mention this, but you can see on the screen the SMART goals. So they're specific, measurable, achievable, realistic, and time-bound. Any goal that you have should meet that criteria for sure. All of your employees should understand what these goals mean. They should all be taking a part of it. So each of your departments under IT should have at least one metric that they're dealing with and they're trying to help with. The metrics should, of course, have a start date and an end date. So what I generally do is we do calendar year, and at the end of the year before, we choose our goals. So we start measuring them in January, we end in December, and before that year is up, we've already chosen the goals for the next year. Now, oftentimes, those goals are building on the ones from before, or the year before, which I find are the best goals to have, and I can show you some examples of those. One thing to remember, that the goals need to be monitored after it's done. So if you say, hey, first call resolution, we're at 35. our goal was 30. We are so awesome. This is amazing. And then you take it off the scoreboard, okay? You leave it aside. We're so good. They're always going to do just as good going forward. And then you pull a report 3 months into the next year, and you're back where you were before. How did that happen? Oh my gosh, we were at 30, we learned the lesson, because your eyes weren't there, that your focus wasn't on it. And energy flows where your attention goes. Or maybe it's the other way around, but you know what I mean. You got to make sure that you're keeping your energy in the right areas and not kind of just forgetting about it. I like to track all of my goals monthly. So I do it manually only because we're just getting up a really cool BI tool, and we'll probably move it to that. But I have any of my direct reports will call in that goal. They have a date, then they know they have to get it to me. And I keep track of wherever they are for January, February, March, April, or wherever it happens to be. And I find that that works really well because we can see the progression. And I'll be honest, most of the time you can watch it getting better and better. And when I have my group meeting and we put that up on the screen, people are really like charged. Like, hey, I took part in this and we're moving that needle. This is better patient care for our community. And it's really great if you can take that goal and tell them exactly how they're helping patients with that. Because sometimes in IT, because we don't directly deal with patients and walk into patient rooms, although sometimes we do, it's really difficult for them to make that connection as IT people and analysts. Well, this helps with that to say, hey, if more people are using that portal, they're getting the information that they need and they're participating in their own health plan and treatment. And all of you did that. So you want to track it back to that. So last but not least on this, in defining your metrics, the simpler the better. Keep it stupid simple. And what I mean by that is if I show you a CIO scorecard, and again, I like to call it an IT scorecard, but that's what my boss calls it. Anybody, if you never worked in technology in your entire life, really should be able to look at that and kind of know what it is. So they shouldn't be something that's so specific and techy and highly clinical. If you've worked in healthcare, you should look at that and say, yeah, I know what that is. Okay. They should have a pretty good understanding of it. I need some water, sorry guys. Getting buy-in from your team. Clearly, you're not an island. You absolutely have to be able to get the buy-in from your IT organization. And to do that, I think the best way is to make sure that each group under IT has a goal. So the help desk, they've given first call resolution. Every year, the number goes up. So they had an abysmal number to start off with. And it's gotten better and better. And one of the reasons that number was so abysmal is nobody was looking at it. I would get, when I first came to this position a year and a half ago, constant complaints. Oh, they never answer the phone. Oh, you know, they're not helping me, and they shift me to someone else. And I said, okay, well, what's our first call resolution rates? And they kind of looked at me like, I don't know. They never even looked at it. It wasn't that we had a terrible bunch of help desk analysts. That wasn't the case at all. The case was that no one was looking at it and nobody was focusing on it. So there was no focus going to the areas that would really make us look good. So you've got to get everybody involved. The EPIC group is involved in EPIC optimization, or if you have Cerner or Meditech, whatever you have, that's your EMR optimization, and they should be involved. And they report those metrics back to me. So you want to reward each group for their progress. So if somebody's really knocking it out of the park, last year my EPIC group really killed it. So I made sure that I was always kind of sending out messages saying, hey, keep up that good work, you're making us look good. I brought it up at a lot of the C-suite meetings and said, hey, you know, my guy's really doing well with this, really being able to not only meet a goal, they far surpassed the goal that we gave them. So kudos to them. So make sure you're giving them a lot of public recognition for that. And we have 4 staff meetings a year where everybody has to come. They're mandatory, even if you're a remote worker. And we bring up the scorecard and we talk about where we're doing well and where we have issues. We never, ever call out the people who are struggling. What we do is we help them to create a task force so that they can get to where they need to be. So it's very supportive, collaborative, because we feel all of those metrics belong to the whole group. So if somebody knocks it out of the park and the other one struggles, well, it's all of us. It's reflective of all of us because we're working together. And creating an action plan for those areas that are struggling, you want to make sure that you do that. And don't be afraid to course correct. This is going to happen. You'll get into, month 4 and you go, this is not the right metric. I don't know why I chose this. So I'm going to show you a couple of examples of picking really bad metrics because we did that. You have to pick a couple of bad ones to realize that you've got some good ones too. It's kind of how it works in the beginning. But don't be afraid to make those corrections. So there's lots and lots of examples of IT metrics. Okay, I'm just throwing up a few on this screen. These are some that I have used. I guarantee you could come up with 100 better ones than this. And I'd love to hear them, by the way. Please. Maybe at the end we can talk about it. But these are the ones that you see a lot. I talked about network uptime. You absolutely have to make sure that your network is available. And like I said, the old days, that was a huge problem because we had lousy servers and lousy network equipment, and hospitals didn't have the money to change them. Well, a lot of that's gone now. The network is generally up all the time, except briefly for updates and things of that sort. But still, it has to be monitored. You should always monitor network uptime. EMR optimization tracker. Now, I'm more familiar with Epic, but I know that the other EMRs have this as well. There are ways for you to track how well you're optimizing your system. So if you bought the system 3 years ago, 2 years ago, doesn't matter. Where are you now? What most people do when they implement an EMR, and I know everybody in this room has heard this before, we'll just get it up, we'll get it running, and then we'll do all that other stuff later. We're going to do it all later. We're not going to do it. We don't have time. So what happens? That time never, ever comes. So you're 3 years out, you implemented the system, you did the foundation or whatever, you did the bare minimum, and half the enhancements that really make the system what it is aren't up and running. This happens to so many organizations. So one of the things you should be tracking on a regular basis to be proactive is EMR optimization. Now, Epic has something called a star rating. It's really, really helpful in doing this. The problem is that every time you get upgraded, your star rating goes down. So it's really, it's very demoralizing when you go from up here to here because of an upgrade, but then you have to start over again. But I'm fairly sure that the other EMRs have something like that as well. And it's just a tracker to say you're utilizing everything you purchase. So for your $60 million, guess what? You're getting your money's worth. That's something my CFO wants to know. One of the first questions he asked me is, we paid a lot of money for this Epic system. I don't think we're getting our money's worth out of it because I don't think half of it's live. He was right. It wasn't. So now that we're monitoring that, guess what? We went from abysmal to doing really well with that optimization, just because we focused on it. They could have done that a long time ago. It's just that the focus wasn't there. Patient portal adoption. Everybody's heard of the digital front door. It's all we hear about. Nobody can really explain what that is, but it's something we need to concentrate on, and we know it. And part of the digital front door is the patient portal. It's probably one of the most important parts of the digital front door. And why is that important? Because that's the digital sort of experience that your patients are going to have after they leave a clinic or they leave the hospital, okay? I am a huge patient portal user. I think they are the best things that were ever created in all of healthcare IT. I can't fathom why somebody would not want to use one. Why wouldn't you? But of course, some of the older generation, maybe they don't have a smartphone or a computer or whatever. Those are the areas where we don't see as much use. But what I find is, as soon as you get somebody on there, even if you get them to check some lab results, they are hooked. They're like, I never have to call my doctor's office again for the rest of my life. I can send a message to the doctor. He or she gets right back to me. I can book appointments. It's a beautiful thing. So getting that adoption rate up is really going to be helpful in patient engagement and moving the needle. Barcode scanning compliance, this is something, we had some issues with this. when we brought in a lot of travelers. And we didn't see as much compliance as we had in the past because they weren't as used to our systems. So we had some issues with our compliance for barcode scanning medications go down. So we started monitoring that. With that monitoring, we got back up where we needed to be in the span of 3 months. It was very fast. Provider in-basket messages. This is something that drives our providers crazy. Our provider advisory group came to me and said, look, if there's one thing that you could do to make my life easier is get all these extraneous messages out of my in-basket that I don't care about and don't need. Has anybody else had this issue with in-basket messages? Yeah, I think it's across the board. So right now we're looking at all of those different categories of messages and trying to figure out which ones we don't need. Now the problem is one provider will say, oh, I need that. Wait a minute, hold on, I gotta have that. Another one will say, well, I don't want that. So we're trying to get a consensus on which ones are important and which ones are not, and we're going to improve in that area. IT staff turnover, I already talked about that. You need more differentiators these days because everybody's poaching your staff. I just need to let everybody know that. That is the reality right now with remote working for IT, which is almost everybody in this room. The bigger systems especially are poaching your staff. It's happening every day. It's happening to me right now, and I had very steady turnover, or no turnover really. So you're going to have to come to the table with something that's going to keep your staff there, and you should be monitoring that. First call resolution, I already spoke about. Very, very important in how IT looks every day. If I call and I'm on hold for 30 minutes, or they hang up on me by mistake, or no one answers the phone, or I get through, yay, and they say, oh, so-and-so needs to call you back, and that person calls you back 2 hours later. Doesn't look good, not a good look for IT. Abandoned call rate is basically, they just hung up because they were sick of waiting. That's even worse. Provider hotline call numbers, this is a wonderful thing that we're monitoring right now. We decided to take some of the issues away from our help desk because we did have a special line for physicians, but it was still going to the help desk. And now we have special people who are principal trainers. They take all the physician calls all week long. They're on call and at night and on weekends. And they can answer that question immediately. Because what was happening was provider calls, he's in crisis, he or she is in crisis. I need an answer now, I've got to get this order in, we're in a code, whatever. And they'd say, okay, well, I'm going to find someone, and then I'm going to have them call you back. What number will you be at? Well, I have no idea what number I'll be at. It was just not effective. So now that provider picks up the phone, makes a phone call, gets the answer, and can serve our patients. Much better way of doing things, and the physicians love it. Budget to actual variance for IT costs. Money's tight these days, guys. I'm sure that's true in most of your organizations. It definitely is in ours. So we want to make sure that whatever's in that budget, that we're not going over that. And we're looking for cost savings ideas. And that's a really easy metric to cover in a scorecard. And then last but not least on this sheet is percent of patient appointments scheduled via the portal. This sort of goes back to that whole digital front door. You want to make sure that your patients have the ability to do a lot of different things through the portal, like any kind of a check-in where they're filling out different kinds of information and they don't have to sit and do it in your waiting room. If they can get that done online, they love it. If they can make their appointments online. So all of those things add to the patient experience and will help your metrics overall. So the next thing I'm going to talk about is security measures. Now, you're probably all aware that we're in very grave danger now with cybersecurity threats coming from Eastern Europe. It's something that I talk about with my group every single day. It's gotten worse and worse. There's a lot of phishing emails out there. There's a lot of malware, you name it, and it's only going to get worse. So we really need to increase our security posture and make sure that we have our eyes on that on a regular basis. So I had said to my security team, I said, we've got metrics. We really haven't been following much with security metrics. So we decided that we are going to do that. And these are just to name a few. Retirement of legacy servers is a big one. Right now, we're moving a lot of our data off into an archival system so that we can retire those servers, because having them on the system is a huge risk. They can't be updated, they can't be patched, they're just kind of sitting there waiting for some kind of malware attack. So getting rid of those is always a good plan. Compliance with phishing emails. Sometimes you have to do phishing experiments to see if there are some people out there who are going to click on, files that they shouldn't, or they get a message from the CEO to buy 200 gift cards and they do it and they scratch the back and then they send the numbers off to the person who actually asked for it. This has happened. I'm not making this stuff up. That's happened more than once. So we've trained our people to look really closely at the email that's coming in because it's usually off by 1 digit. And by the way, nobody in the C-suite is going to ask you to do any crazy things like that. So if it looks like a crazy idea, you better call that person and make sure that it's accurate. Patch management compliance. This is something we look at regularly with our security council. It's something that should be checked. You want to make sure you're checking patch management on your servers and on your desktops. Risk assessment scoring. It is mandated that you do a risk assessment every single year. We do an internal and external penetration testing, and we get a report from those two things, and that's how we create our risk assessment. And anything that's critical or moderate, sometimes we look at a few of the lows too, we create a risk mitigation plan with those. But we monitor how many criticals we have. So if we're doing a really good job, every year we should have less criticals. So that's something that you can monitor and say, all right, we're actually doing a pretty good job here. If they go up every year, well, there's something else you should be doing. You can look at your virus infection activity. We use Trend Micro for this, but everybody does something a little bit different. We want to see how many viruses are actually getting past that. And then security and HIPAA training compliance. Are people taking those educational sessions or whatever and actually sitting through them, taking the tests, and doing what they need to do? How many times is that actually happening? Well, you can monitor that as well. Excuse me. Okay, so this may be a little bit hard to see on the screen. This is just a copy and an example of a manual CIO scorecard. And again, I prefer to call it IT scorecard, but you can see one of the things monitored on here is an EPIC star rating. So one of the tough things about doing this is you need to pick metrics that you're really doing very badly in. You're not supposed to choose the ones that you're kicking out of the park. That's not what this is about. And I had a lot of my guys come to me, and give me certain things where, we're already at an A+ on them. Like, why am I monitoring that? You're already doing a good job with it. So these are the things that we were not doing so great on. So I took this job about 1.5 years ago, and my boss came in and said, there's 2 things you need to work on that are going to really move the needle. And the first one is you've got to optimize this EPIC system. We paid $1 zillion for it, and we're just not getting anything out of it that we needed to. So in EPIC, it's something called a star rating. You might be familiar with that. Every system has something similar to this, so I don't know what the others are called. So we had a goal of getting it to, I think the goal was a 7, and we did get to an 8, which is 8 is really good. I mean, they call you up, at the user group in EPIC when you're an 8. So we felt really good about that. Unfortunately, every time you update the system, it goes down again. So that's kind of a bummer. But the MyChart adoption rate, ours was abysmal. I mean, really abysmal when I first came, and that was another thing we needed to do. We've gone up every single month in the last 18 months. We are right now, I think, at 35. Believe it or not, I have been told the average is 35. It's so low. There's certainly systems out there that are in the 80s. A lot of them actually, especially the good systems. So you want to keep striving to move that number up because there really is a very serious correlation between patient portal use and patient satisfaction. It's been written up many times, and it's something that's worth working on. Here I go, losing my voice. So I had the network uptime. That wasn't, a big deal. First call resolution, we did really well with that. But then you'll see some at the bottom, not so great. And this is why I wanted to talk to you about not always picking the right things for metrics. This is our first year we've moved on since this is an older one. And I changed a few things on here too because I can't give out all that information. But we did things like, let me Completeness of medical record and percent of H&Ps within 24 hours. Well, why didn't we do that great with this? I'll tell you why. We didn't have that much control over it. So when you're picking metrics, you do have to get the buy-in from other departments to help you out, 100%. But in some cases, no matter what you do, you're not going to be able to move that needle because you just don't have enough control over the area that's making that go down. So what I ended up doing was I have a really great relationship with our CMIO, and he took on a lot of these things and actually did pretty well with them. So we kind of split it up from there because they really weren't there wasn't enough IT relationship with that. So this is just, something you could do. Again, this is manual. It's an Excel spreadsheet, not techie at all. We just purchased Sisense, and a lot of that will go through Sisense, I think, from here on end. But you can start with nothing. It's really easy. So it takes a village, and I've mentioned this a couple of times today. You have to collaborate with your executive peers to meet your goals. So for example, if you're really pushing the whole IT portal adoption, you've got to get your community service people, your marketing people, to help you put up banners, get it on Facebook, get it on the news, to put it on the local news. That's not something IT is going to do. That's something that you have to give to your marketing people. So we work really closely on marketing to move the needle. One of the other things we did was we brought tablets to all the vaccine pods. And we said, while you're here, you can sign up for MyChart. And that worked really well because if you signed up for MyChart, at least at the testing pods, they could get their result really quickly with sometimes less than 24 hours. So that worked great, and that was a real motivator. All the employees have to be all in. Many of your goals rely on the assistance of other departments, as I mentioned. So again, they're going to come to you too. So this works both ways. I've had many people come to me and say, hey, part of what I need to get accomplished this year has to do with technology. Can you help me out? And I'm sure, I'll help you out, no problem. You've helped me in the past. So it makes for great teamwork throughout the organization and not just in your own group, because they can't stand alone as an island either, and neither can you. So you have to help each other out. And technology, as you know, hits on everything. So remember to assist your peers in meeting their goals as well. Okay, the struggle is real, my friends. This may sound really easy. It's not. It's definitely not easy. It's worth it, and everything worth it comes with a little bit of struggle, right? But it's not as easy peasy as I made it sound. So these are some of the things that you'll have to deal with. You won't always choose the right metrics. I showed you an example of that a couple of minutes ago where we didn't choose the right metrics because we really didn't have that much control over those metrics. My boss wanted us to do it, but I said, it's great, we can push it a little bit, but if the docs don't want to do it, there's not much we can do about it. So you won't always get the help you need to accomplish this. Sometimes people will dig in their feet and say, hey, COVID, can't do it, too busy, you're on your own. And you have to kind of go around people or whatever and get really creative on how you're going to do it. Priorities can change mid-year. We all saw that, didn't we? What happened to all the projects you were working on when COVID came? Were you able to still working on them? Probably not. I mean, all the priorities went out the window. Right now, we have a situation where we're building a new hospital. So everything about this new hospital is going to be the priority next year. Absolutely. We're going to be shifting everything we're doing on to opening the new hospital. So that's a priority shift. You won't always get that buy-in that I talked about. Some of you'll have some employees who are just not into it, or maybe your boss isn't that into it, or some of your peers aren't that into it, and you have that trouble getting what you need. Staff shortages can absolutely impact your goals. If you're trying to do something with building certain things within your EMR, and all of your outpatient people, your ambulatory analysts have left, you're not going to be able to meet that goal, and that's going to be a problem. Sometimes meeting the goal takes longer than expected. This one I think is okay. So say you started your goal in January. By December, you didn't quite hit it. Maybe you were shooting for 15%. I don't know. It doesn't matter what it is. And you hit 12. But last year, you were 9. That's a success. So you didn't meet the goal, but you definitely did better than you did the year before. So my advice to you on that should be, do it again. Put that back on your scorecard. Rejigger what you were doing. Change your plan around a little bit and try to meet that goal again. Maybe make it a little higher that year. But as long as you're making progress, that's the only thing that matters, even if you don't hit the goal, because sometimes the goal is just too lofty or too ambitious, and life happens and you don't get there. But you have to understand what's real progress. And progress is moving forward and making a difference. So celebrating those wins, there's going to be a lot of them. I think if you do this, what I'm telling you about having the scoreboard, you're going to have a lot of wins. Because when you focus on things, they just get better. It just happens. So you create a group incentive for those goals. We do gift card giveaways at all of our big staff meetings. And you can even have little, fun competitions between, say, inpatient or ambulatory. You can challenge other departments to say, hey, if you meet your goal or I meet my goal, maybe I'll take you out to lunch or whatever it happens to be. And then you party hardy when the goal is met. That's my favorite part. Okay, so we talked a little bit about monitoring the metrics. This is a very important piece of this. So you picking the right metrics is super important. Monitoring them, absolutely important. And why? Because where energy flows, where your attention goes. So as you can see that rock, see the big rock rolling down the hill? That's what's going to happen to your goals if you take your eyes off them and you move on to something else. They're just going to go away. They're going to roll right back to where they were before. So continue to monitor the metrics, or they could slide down quickly. Important goals that have been met, and we did this with barcode scanning. Once that goal was met, it was so important that we keep it there that it moved to a corporate scorecard. So we kind of pulled it from ours and moved it up to something that's monitored much more frequently than our scorecard. And I thought that worked greatly. So building on previous wins will keep the focus in the right area. So again, if you have a metric that you can monitor by a percentage or some kind of sort of a number, those are the easiest ones. Make sure that you can build on that from year to year. So you're not going to get, if you say, I would like 100% patient portal adoption in 1 year, you are going to fail. That is not going to happen, not in a million years. I don't think anybody's reached that. So that's a ridiculous goal. But if you said, I would like to improve by 10%, yeah, you can do that. That's very doable. And then the year after that, you say, I'd like to improve by another 10%. Let's see if we can get there. Let's see if we can get to the top echelon, which is like 65, which is supposed to be really good. If it's moving and every month you're gaining traction, why not keep going? Something that's really important. Okay, so then you've got your goals. You knocked it out of the park. You did a great job for 2022. Here's 2023 coming down the pipeline. You're in December. You got to start thinking about next year. Metrics should be built on each other from year to year. We already talked about that. Metrics will shift according to organizational priorities. I just mentioned one. We're building a new hospital that's opening October 2023. And I can tell you that I'm going to have to drop everything and move all my staff over to getting all of those projects done. That's what happens. That when my boss looks at what I have set up for next year, he's going to go, hold on, everything on here needs to be about the new hospital. And that's true. Monitoring past metrics is key and not dropping the ball with that. Choose your problem areas and not what you're really good at. A lot of people, I've seen this happen a lot, where people choose the metric that they've been, doing great with for 10 years. Well, that's not going to get you anywhere. You have to choose the ones where you're like, we're really not doing so well here. Maybe a little embarrassing when you have to show your scorecard because the numbers aren't great. But those are the areas where you can really move ahead. And get feedback from your team. My team always has the best ideas when it comes to this. Always, always, always. We have one meeting a year. We talk about metrics. I go around the room and I say, what do you think we should be monitoring? What should we be doing? And they give me great ideas. So in summary, my long-winded speech here. Work with your senior team to create value-based metrics. And value-based means that you are fully contributing to the strategic plan of the organization. You're not running off in your own boat and taking off and saying, you know, I'd like to do something that has nothing to do with what the hospital is trying to do. You have to work with them. You are a support service. Create buy-in from the C team and the IT team. They both have to be on board. Find ways to motivate your staff for success. Make sure that you are monitoring and documenting, most importantly, every metric at least monthly, if not more often. Monthly should be bare minimum. Update the team regularly so that they see the scorecard and they know what it is and they know where they are, and if they're struggling, get a task force together. Celebrate the successes and create action plans for the lagging areas. So if everyone is moving forward together, then success takes care of itself. I mean, that's what this is all about. If we're all working together, we have common goals, we're moving in the same direction, you're going to succeed. That's just the bottom line. It's going to happen. And with that, I open it up to any questions. Anybody have a question? I have a question. Sure. We have microphones if you like.
Awesome. Can everybody hear me?
I think so.
Okay. Obviously, you just spent a lot of time talking about metrics. I didn't see anything about QoS mentioned specifically. Are you able to maintain like SLA level QoS, and if so, how do you do that, and what are some
That's
challenges?
a great one. We are, I would say, in our infancy with SLAs right now. So you're talking about the overall technical SLAs? We have just started doing that, but that's a really good one. It's a great example of a metric and one that I didn't even really talk about. So if you're using, hopefully a lot of you are using an ITSM system where you really can track your SLAs. But this is stating that if somebody puts in a project and, or asks, hopefully you have a project intake process, so they enter that project in, they want to know precisely how long that's going to take. And how long can we say we can always get X, Y, and Z done in 2 weeks? Or unless there's something else going on, that will take at least a month. Right now, all that's out the window because we have so many supply chain issues. So, you know, the SLAs aren't working very well right now. But certainly, I think SLAs would be a great example of a metric that you could use in the technical side. Great idea.
Hi, Susan. Ronam Sadikis,
Hi.
Hartford Healthcare. One of your first slides, you mentioned turnaround time for delivery.
Yeah.
And this is something I've always struggled with because, you know, we deliver artifacts, business intelligence artifacts, visualizations or data sets, and you know, how do you measure whether you're coming up with a standard when it's very difficult to come up with a standard?
Mm-hmm. It can be, and there's certainly going to be outliers to that. It depends on what sort of that project is all about. I think that you have to build in a buffer if there's a lot of unknowns. And I think that's what you're trying to say. Right now, trying to stick to any kind of a timeline is almost impossible because of supply chain issues. We're trying to implement Rover, some of you might be familiar with that, and we can't get iPhones. You know, it's taking forever to get those. So I do feel your pain with that when it comes to trying to have, figure out that turnaround time. I think you do the best you can under normal, typical circumstances. So you build that time frame and you say, you know, if we didn't have all of our supply sitting in China right now being held up in a normal kind of an existence, this is the usual time frame. And if you go over that, you've got to explain the variance. Just like a budget, it's the same thing. But times are very hard with that right now. Hi.
So great presentation. Thanks for
Thank you.
everything you're doing. In the world that I sort of think about when it comes to data, which metrics is obviously just part of how you measure that, it typically falls into administrative, clinical, and financial.
Mm-hmm.
Based upon who cares about the data.
Yeah.
So you have data that relate to all three of those domains, and probably other domains that I might not be thinking of. So when you think about your user community, the folks that actually care about this data, I know you care about it all, but the rest of your organization, the CEO, whoever your stakeholders are, which are the ones that you focus on most importantly, if you had to rank order the domains of that data? Which are the ones that you say, if we fit the patient safety ones or the clinical guideline ones or the support ones, whatever they may be, which are the ones that are sort of in the top of mind that are important for you?
That's a great question. I would say right now, patient safety and patient engagement are really big right now. And when it comes to optimizing the EMR, you're implementing things that help with that patient safety. So getting back to what I said earlier about making sure your employees understand that they're contributing to the safety of patients and the quality of the care. So anything dealing in those optimization projects that deal with patient safety, any kind of engagement for the patient, things that are making a patient's life easier, because patients are always first, are first and foremost. And then I think, secondly, we have to think about what helps the experience of our providers and our nurses. So we have a lot of control over that. If the Wi-Fi keeps breaking, they're not going to be happy campers. Well, we can do something about that. If the WOWs are old and they're falling apart, we can do something about that. So I would say it's always patient first, and then employees. We have to deal with the safety of our employees and the experience of our our employees would come next.
Because I don't see a long line here. If you don't mind, I'll take a second question.
Go for it.
So, one of the issues that I've seen throughout my career in HIT, in technology specifically, is a lot of technology departments don't understand they're really customer service departments for the business. They sort of think that they're the end-all, be-all in many cases, and I know many organizations that are convinced that that's what their job is, and it's like, no. Your job is to support your constituents, as you just talked about.
Absolutely.
And I talk about constituents as providers, patients, and employees. That's the role that I talk about. So when you came in, it sounds like you changed some of the milieu a little bit. Did you find that one of the issues was that the folks in your department weren't thinking of themselves as supporting the business as compared to we do IT?
Absolutely, yes, 100%. And, I'm not someone who likes to, talk about the person who was there before. That's gone, that's past, and he was actually an excellent CIO. But it was a little bit of a wake-up call. I don't think that they were making the connection to, wow, what I do every day really impacts patients. So I tried to kind of, bridge that gap to say, everything you do, it doesn't matter if you work on phones or cabling, help desk, every one of you is increasing the patient experience and making patients safe. And it's really not that hard to make that connection, but they weren't doing that.
I found it's a matter of just thinking about what the end value is of what you're doing as an IT person, because oftentimes it's just, well, my job is just to fix the servers.
Right.
It's like, no, you understand, that server, if it's down, here's the ramifications.
Right.
So
I can't get a data that's going to help me make that patient's life better.
Congratulations for doing what I would classify as what IT 101 is, but a lot of organizations don't do it.
I agree with you on that, absolutely. Thank you. Hey there.
Susan,
Hi.
how are you?
Doing well, thanks.
So I have a question. You touched on employee retention being an issue. Do you trickle down the CIO scorecard to employee MBOs, management, all the way down to staff level?
Yes, absolutely. That's a great question, Justin. So, of course, my leadership team is extremely involved in what I do, and they're all evaluated on how well they actually are able to meet these goals. But in addition to that, at their own group meetings, they get all of their staff involved. So this goes all the way through the organization, from a help desk analyst or a data operations person who sits in the server room, all the way up to my director of the EPIC program. So it is absolutely everybody. Yes.
So you emphasize the importance of metrics being a motivator. How do you create and maintain visibility into those metrics up and down the organization, but limited to the ones that people are really kind of responsible for or care about?
Well, what we do is, these scorecards are shown all over the place. So they're shown at my big staff meeting. They're shown at the group meetings. We have a senior team meeting, and what we do is we rotate through for the scorecards. So say, Susan, you're next week. You're going to talk about all the progress, or lack thereof, that you've made so far this year on your scorecard. And you're going to tell us, if you're not meeting it, what are you going to do about it? So it's at that level. But these go all the way up to the board of directors. So everybody sees these. So even more important that you want to make sure that you're putting your best foot forward. But it's something that's seen throughout the organization. It's up on that wall, anywhere you go. And by the way, it's not just, there's not one just for the CIO. Everybody has one. So there's a CNO scorecard, there's a COO scorecard, you know, Chief Nursing Officer, Chief Medical Officer. They all have their own. This is just kind of the IT world right here. And we help each other out with those. So, any more questions? If not, thank you so much. I really had a very enjoyable time speaking to you today. Thank you.